Hello everyone and welcome to Chat with Nene Alice. If this is your first time tuning in to Chat with Nene Alice, don't forget to like, don't forget to subscribe, and don't forget to send in your comments because together we can all improve on this channel. Viewers, today I have with me Ramatu Kargbo. Ramatu works for the Ministry of Gender and Children's Affairs, and she is the Sexual and Gender-Based Violence Coordinator, and she is also a GBV specialist, a child protection specialist, and a child safeguarding specialist. So we have the pleasure to have Ramatu with us here today, and we are going to talk about the one-stop centers in Sierra Leone. So over to you, Ramatu. Hello, and do you want to say a few words to viewers before we start the conversation?
Thank you for inviting me, Alice. I've listened to a few, I've watched some of your videos and they're very good, and I'm excited to be part of your program today. Thank you.
Thank you so much for gracing our stage. The very first question I want to ask you, it has to do with the one-stop center. That's why we're here. So what is this concept about the one-stop center?
The one-stop center is actually an innovative approach set up by the Ministry of Gender and Children's Affairs to respond to cases of sexual and gender-based violence in Sierra Leone. Of course, we're all aware of the issues faced by survivors in accessing services. There is an economic burden, there are social issues and medical issues, and of course legal issues. So the one-stop centers were created to ease the burden on survivors by creating a space within government hospitals where survivors could easily access services without being stigmatized, and where also they could receive transportation. So more or less it's like making things easier for them. And also the one-stop centers promote survivor-centered approach, which is lacking in most of the existing responses. A survivor-centered response simply means that you are aware of the specific needs of the survivor. Sometimes survivors they have disability, or girls, boys, men, women, they have specific needs. So we identify these specific needs and we develop plans to support them. So, and in the process also we ensure that they are respected and they are treated in a dignified way. We do case management for them and follow them up as they access their services. So with the one-stop centers, they are sure of getting timely services. They are sure of being accompanied throughout the process of service provision. So basically, that is what the one-stop centers are about.
Thank you so much. You've talked a lot about the one-stop center easing the burden on our referral hospitals and other agencies who have been providing support. But I also want you to be very clear with regards to types of services that the one-stop centers provide.
Okay, first of all, we give priority. Let me begin by saying that the one-stop centers are established within government referral hospitals. Okay. Because the aim is to promote a multi-sectoral approach among the service providers. That means the Ministry of Health professionals should be able to work with the Ministry of Gender professionals and also the police. So when you come to the one-stop center, you will find out that there is an FSU investigator attached to the unit, so they provide legal services, even though not in its entirety, because statements are taken and then the investigators go out and do their investigation, visit crime scene, and then do a report and send back to the state council or the DPP. So at least we facilitate that initial process, the initial legal process. And also when you come to the center, there is a center manager assigned by the Ministry of Gender that serves as a psychosocial counselor who provides psychosocial counseling services, because sometimes the survivors are traumatized by the incident. So the managers provide these services, and they also coordinate medical services, because the centers are within government hospitals. We have some medical doctors who are also attached to the maternity wards. They are supporting the one-stop center. So they do the medical examination, and also they produce reports, because sometimes before survivors used to pay for the reports. They will do the examination, but when it comes to providing the reports, they used to pay until Rainbow started providing free of charge services. So more or less the services are free, and the one-stop center managers coordinate medical services, they provide psychosocial services, and also the legal services. And in addition, also the center managers, they serve as case managers, case workers, because it's a very difficult thing for the survivors to go through. You know, the legal process is complicated, so they need somebody who can accompany them throughout the process. You know, somebody who will go to the police and follow up for the report, somebody who would come with them to court, somebody who would come to the community to find out what is happening. So the center managers are there to give this kind of support to the survivors. So so basically that is that. There's legal, there is psychosocial, there is medical as well, and also if there is need for safe home facilities, they also make referrals to safe home or maybe to foster families when necessary.
So you've said a lot, but I want to know, before this time, the FSU was the one coordinating all of these, referral services that have been provided. People will come to FSU and they will say, go to the hospital, and they'll give you, a referral paper, or they will, charge the matter to court, for legal referral.
Yes.
So I just want you to explain, what is the link between the one-stop center and the FSU? So it doesn't look like a competition. So what is the link, and is there any way, to harmonize their roles?
Actually, that's the main reason for the establishment of the center, to bridge all these differences, among service providers. So we promote that comprehensive approach among service providers. So even if you don't find the police officer in the one-stop center, but the FSU has assigned the unit. They have assigned like one FSU per, because initially we thought we were going to establish the one-stop centers across the country. But when we assessed the work that Rainbow was already doing, because they're doing fantastic job, by the way, we realized that we cannot duplicate services. Let's go to areas where there are no services. So the one-stop centers are actually established in places where there are no Rainbow centers. So, and we have a good relationship with the police, so that's why they assigned like an FSU who does the statement taking, within the center, and everything also is
well harmonized.
Yes, it's harmonized.
Yeah, because I was thinking, why don't we have one-stop centers across the 16 districts? But then, thanks for the clarification that the one-stop centers are in districts where there are no Rainbow centers. So, for example, you cannot find the one-stop center in McKinney because the Rainbow is there.
Not at
you cannot find a one-stop center in Freetown because we have Rainbow headquarters here. So
no, we still have, because Freetown is very big.
Yeah.
So, and the Rainbow Center is at the PCMH.
Okay.
And so we have another Rainbow Center in the western area at the King Hammer Road hospital, where we also provide similar services. But the ones in the provinces, they are really good, they are effective and functional.
Yeah. Okay, so the other thing I want you to just elaborate a little bit before we draw the curtains down on this conversation. Can you just tell us briefly, what impact the one-stop centers have created in terms of reducing cases of, sexual and gender-based violence?
It's responding to sexual and gender-based violence is a Herculean task. It's very costly. It needs a holistic collaboration. So as a ministry, we took advantage of the fact that it's government that is in charge. So it was easy to get the Ministry of Health on board, as well as the police. Like we have this kind of collaboration, so we can work together and support. So I think the benefit of the one-stop centers is the fact that there is somebody to accompany the survivor throughout the rigorous process of accessing services. It can be very tedious for them. It's economical. You know, there's a lot of financial burden on them. So there's somebody who's there to support them, and it's still a pilot project. By the way, it's only a year and about 8 months. Like it was established in July 2020. So we still have our teething problems. We're learning every day. In some areas, you get a lot of cooperation from the service providers, especially the hospitals. In some areas it's difficult because, and you know what happens with government, they're always under resourced. We need a lot of,
on donors
we depend, yes, it's like we're mostly funded by donors, you know, to run. Maybe they're trying to see if they can trust us to do this, because it's the first time that government is even daring to provide direct services, because it's very costly. But we're taking advantage of the relationship that we have amongst us as government, as partners. Also, we're getting a lot of support from international NGOs working on child protection. So we're trying. We have not yet reached that point, but we're trying to be there. But if we already have the structures in place, and it's a place where survivors, they feel confident to go, which I think it's very good for them.
That was another thing I wanted you to throw light on. Is it, you know, are survivors very comfortable in accessing these centers?
Yes, because the way that the centers are set up, at least in most of the places, it's such that it ensures confidentiality. In some centers, there are 2 entrances. You can come to the hospital as if you're coming for medical services, and then you can sneak into the one stop. And once you come to the one stop, it's like a safe haven, because you will meet somebody there to listen to you
and to provide you
support. To follow up on it. You know, and for many survivors, they appreciate it a lot, because like they are not alone in the journey. There's somebody with them. So that alone is, for us, we think is a big thing. Yes.
Anyway, so thank you so much, Ramatu, you know, for throwing light on the one-stop center. It's a very good initiative, and it has helped a lot, you know, in reducing cases of sexual and gender-based violence, and it's another means of support for survivors of violence. And we know how much we have been craving for people to receive the necessary support in terms of legal, in terms of social, in terms of psychosocial support, and you know, and all of that. So thank you so much, Ramatu, for the work you and the One Stop Center colleagues are doing, and we wish you all the very best, and we hope that together we can end violence. Thank you very much. So viewers, if this is your first time tuning in to Chat with Nene Alice, don't forget to like, don't forget to subscribe, and don't forget to send in your comments. Thank you so much, and have a blessed day.